Hi, it's Bill, the knee pain guru, and welcome to video we're going to do today, which is on why your knee hurts and what you can do about it. Thank you for being here today. We'll be answering questions in a few minutes. So in the live chat, if you want to start typing in your questions, start typing those in now. I'll get to those after we do this short training, answering those questions, why your knee hurts and what you can do about it. Okay. Before we get into any of that, it's really important to understand where the medical model fits in to what I'm going to share with you today. If there's something going on with your knee, you have pain with your knee, make sure you go to a doctor first and get a diagnosis. You want to know what you're dealing with first before you get into any holistic or alternative or natural therapies. It's important to understand what you're dealing with. So if something is broken or torn, your strategy is going to be something is broken or torn in your knee. It's a different approach than getting into if your knee just hurts and the doctors can't give you a reason why your knee hurts. So that's very important to understand. So why your knee hurts. This is going to sound super, Bill, that can't be it. Okay. Your knee hurts because there's tiny little nerves the width of an eyelash in your knee being squeezed, being irritated, sending a signal to your brain that you have knee pain. That's why you have pain. Now, of course, if something is broken or torn, there's a slightly different reason, but ultimately it's because of those tiny little nerves that are being irritated. That's it. So that's why your knee hurts. The fastest way to get your knee out of pain is to get the pressure off of those nerves. So they're doing these things that hopefully on the other end is going to get the pressure off of the nerves and you won't feel the pain. So you look at physical therapy. The idea is to strengthen the muscles in the legs in the hopes that the pain will go away. Drugs and shots to numb the pain. And the idea is if you numb the pain long enough, hopefully when the drugs or the shots wear off, that the pain won't be there. And many times that's not the case on the other side of that scenario. You have surgery. Doctors many times will do X-ray, CT scans, or MRIs, and they can't see anything as to why your knee hurts. So they'll do an exploratory surgery to fix what's going on. A lot of times the trauma from the surgery actually creates more pain in the knee afterwards. Exercise. You'll hear a lot of people in personal trainers, even physical therapists, occupational therapists are talking about strengthening the muscles in the legs. But if you have a dysfunctional pattern because the knee is in pain, strengthening a dysfunctional pattern just makes a more dysfunctional pattern. Doesn't really work. That's why so many people are in pain. And the more you do it, the worse the pain gets. Welcome, everybody. Make sure you're entering your questions over here on the side. Stretching, like yoga. That's another approach. Stretch the muscles in the legs. Stretch the muscles in the calves, the quads, the hamstrings. But a lot of times the joint hurts when you get it to a range of motion that you're stretching it. So it makes it kind of this loop that you're in pain. The more you use the conventional approach may numb the pain for a little bit, but then you're back in pain. So you're kind of in this loop that you just get kind of exhausted with the fact that no matter what you do, you're still in pain. So what do you do? I mean, it's one of those things. What can you do about the pain when you understand that the only reason your knee hurts is because tiny little nerves the width of an eyelash are being squeezed in your knee? So wouldn't it make sense that if we get the pressure off of those nerves, you start feeling relief in your knee? Wouldn't it make sense that when your knee's in pain, it's squeezing tight? And the tighter it squeezes, the more stress you're under as a result of that pain, that the more those nerves are irritated. And the more you try to push through that pain, the worse it gets. That's logical. That's like if you put a series of understanding what is going on with the knee, what you're dealing with, what you're struggling with, and the more you can't get an answer from the doctors and the physical therapists, you're just putting yourself in more pain. So what can you do about it? You can create comfort in the knee. So there's a big misconception when I speak about making comfort, creating comfort in the knee. You think, oh, well, I just sit on the couch. I'll wait and let the knee rest. I'll rest the knee. I won't exercise. I won't hike. I won't run. I won't go to the gym. I won't do those things. But what happens the moment you start getting back? After you take a week, a month, several months, maybe even years off, and then you go back to doing exercise again. You start your active lifestyle again, the pain's still there. Because a dysfunctional pattern still exists, whether you're doing anything or not. It's kind of like a car that got into a car accident and the frame is crooked. You could park the car in the garage for 3 months, 6 months, 9 months, a year. You take that car out of the garage, the frame's still bent. That's what happens in your knee as a result of the injury, the pain that you're feeling, the trauma that the knee has been through. So what ends up happening? What ends up happening is that, and the goal, the way to get out of pain is to create comfort, to get the pressure off of the tiny little nerves, the width of an eyelash that are being squeezed, sending a signal to your brain that you have pain. So how do you create comfort? When it's not sitting on the couch, it's not stopping your physical activity. You work with the tiny little movements in the joint. Tiny little movements meaning the joint bends and extends. And we're talking about tiny rotation, side to side, forward and back, apart and together. Those tiny little movements that squeeze on those nerves that create the pain that you experience when you move. So if you want to learn how to do that, I have a website, kneepainguru.com, thekneepainguru.com. I have a 7-day knee pain reduction challenge you can check out. Short little survey, find out where you're at, and then I have more on the other side of that. But that's why your knee hurts and what you could do about it when everything that you've been doing hasn't been working. So, okay, I am going to start asking or answering questions. I got a question here from Singh here. Had a tibial plateau fracture treated with a metal implant. After 4 months of surgery, I still can't walk. My knees feel very weak, and it's not stable when I try to walk. Okay, stability in the knee comes or happens. Stability or instability in the knee happens as a result of the tendons and ligaments in the joint being weak or imbalanced. When tendons, this is quick anatomy. Tendons connect muscle to bone. Ligaments connect bone to bone. When you strengthen the muscles in the legs, you're strengthening muscles. So you're strengthening a portion of that equation, but we're not focusing on the joint. The joint can become unstable because the imbalance of tension as a result of the body compensating for pain. Think of it like a tent pole. You got ropes on a tent pole. The tent pole is going to bend in the direction of the tightest rope. And if the if the tent pole isn't straight and these ropes have different kinds of tension, the pole's going to be crooked to some degree. This is what happens in the knee. There are tent pole or ropes, the tendons and the ligaments that support the joint. And if there's an imbalance of those tendons and ligaments as a result of the body compensating from the injury, the accident, the trauma, the surgery, whatever that is, it creates an imbalance in the joint. So when you step, it's not going to feel quite right. Now, there also can be factors regarding the tibial plateau fracture. If there was okay, he has a grade 2 ACL tear. Grade 2 ACL tear. So there's an imbalance in the joint. The body compensated for the ACL tear. A grade 2 ACL tear means there's a part of the ligament in the knee that's still intact, but a portion of it that's torn. So understanding if there's torn meniscus in there, there's trauma from the injury, there's trauma from the surgery. First and foremost, we want to create comfort in the knee. When we create comfort in the knee, we can begin to see and understand and feel and become aware of what's going on underneath that. Whatever happened to you it was a trauma that your body felt. So, go take the 7-day knee pain reduction challenge. See how that begins to give you relief in there. Because when we relax what's tight, balance can be reestablished in the knee joint so it doesn't wobble so much. It's not so much, there isn't so much pain. Okay, if you got questions, ask them. I think it's over on this side. This is the second live stream. I did one last week. Here we are today. There was a question here yesterday. Okay. Got left knee pain after jogging nonstop every day for a year. Got left knee pain after. Within that year, I wore a pair of crappy jogging shoes from Payless, which I think contributed to the knee pain. It's an imbalance of tension that's going on in there. Crappy shoes can equate to an imbalance of where you're compensating, the foot's not hitting correctly. We got to look at what's going on in the pelvis, the hips, the lower back, the tension in the feet, the calves, the shins, the quads, the hamstrings. And you can find your way out of pain through comfort. The big thing is when you have pain, and this is going to tie in with Singh's question about the doctor saying you have to do more exercises. If you have pain and then you're doing something like physical activity or jogging or something like that that creates more pain, you have less awareness of what's going on in the knee and in your body because the body ups the ante for the pain. More pain is created. It's like if you have a loud noise and you don't want to hear that loud noise, so you play a louder noise. And you don't want to hear that loud noise. And what ends up happening is everything gets so loud in your nervous system, you can't think clear because the pain ways to make it quieter. Then we can start hearing better. And this is what comfort begins to introduce to your nervous system, to your knee, to your body. You gain more awareness and a deeper understanding of what's going on in your body so we can get to the source of where the pain is originating. So the idea, create comfort. Okay, let's see. Good, quiet. Let's see. Jogging. Okay. Fergus says, are body weight deep ass to grass squats a bad exercise? My physio says doing those every week are extremely strain on the knee. Says to cut back and do every couple of weeks. Any opinion? Yes, I have an opinion. There's layers to that. Are you doing the ass to grass squats with or without weight? Because doing them with weight is a different conversation than doing them without weight. Two different conversations. Without weight, I think full squats like that are phenomenal for the body. I think it's healthy for the body to do those full types of squats. Unfortunately, people do the squats incorrectly because there's too much tension in the hips and lower back. So it puts more strain, imbalance of strain in the body. So keeping the flexibility in the pelvis when you're doing the squats is going to help with the knee joint. So addressing the tension patterns first and relaxing the tension so you can do a full squat correctly is going to be the way to do it. Many times, if you're doing squats like that, you're holding your breath. Breathing is a huge part of the tension and stress that build up in the neurological system, the body, because we don't understand how to breathe in relationship to the exercises that we're doing. Okay, let's see. My personal trainer said my hip was uneven. I think one leg is longer than the other because of how my hip is constructed. I'm a male, by the way. Hips become uneven the majority of the time because of an imbalance of tension in the body. You're sitting in your car. You're sitting watching TV, crooked. And you're watching stuff on television, you're talking on the phone, whatever that is. Now your body is sitting in that uneven, crooked position. Now you get up to stand, it's going to be crooked. It's not going to be balanced. So that tension is going to make the hips uneven and one leg shorter. Short leg, long leg, it's a result of the rotation of the pelvis. Not because that's what you're condemned to experience or how you were born with. Imbalance of tension in the body happens as a result of patterns that we end up living with on a daily basis. Those can be easily corrected by introducing comfort and releasing the tension patterns. Go take my 7-day knee pain reduction challenge. See what that is. thekneepainguru.com. Here, I'll put the link in the chat box here. Where are you? Here we go. Go take the 7-day knee pain reduction challenge, begin to see. And you see, like, the moment you're engaging reflexes, when I talk about creating comfort, you're engaging reflexes that fire at 286 miles per hour. The same reflexes that when you go to the doctor and the doctor taps your knee with the hammer and your knee jumps, those are the same reflexes that are engaged when the body's in a position of comfort. So your body takes on tension as a result of injury, accident, trauma, some sort of pain, and it tenses up that fast. Your body can let go of tension equally as fast if you understand how to release the pressure off of the nerves that are being irritated. That link will give you 7 days worth of training. And the whole goal is to get you to feel that release, that relief, the change. Okay, so that talks about imbalance of the hips. X-rays of right knee shows spurs bone to bone, but lower back is sore in my right hip. Yeah, that's what happens. Taking care of we can't look at the body through a funnel. Like, we have to look at the body holistically. We have to look that if we stub a toe, if you stub your toe, your shoulders go up towards your ears and you clench your jaw. That's how we work. We can't isolate the toe and not think that when we hurt it, it doesn't affect the rest of the body. Same thing with everything from your toes all the way to the top of your head. It's going to affect your knee pain is going to affect how you breathe, how you think, your emotions, the tension in your body, how you respond to people, how you walk, how you move. It affects your entire structure. It affects your entire being. It affects your entire life. And to think if we just do exercises to get the knee out of pain, strengthen the muscles in the legs, that all that other stuff is going to go away, you're deluding yourself. So we got to look at everything. Now, bone spurs, bone to bone, lower back is sore, hip is tight. There's a lot of things that are going on that you got to start somewhere. You create comfort, start creating comfort, and do that comfort a little bit every day, over and over. And what you're feeling, what you're experiencing in your body in the next couple of days, in a week, in a month, when we're creating comfort day in and day out, every time you experience pain, you move to comfort, it begins to open up new realms of possibilities for how your body's capable of healing. And that creates the state which your body is able to heal itself. So go take the 7-day knee pain reduction challenge. Okay, had a car accident resulting in my leg not being equal in length, one leg shorter than the other, 73 years old, not sure if I can fix this. I just talked about that. Tension, the car accident, bam, you hit, your body tenses up, one leg is shorter. And the only way we begin to create balance back into the body is by beginning to create comfort and understanding those patterns that are going on in the body. Go take the 7-day knee pain reduction challenge. Okay. Let's see, question here. Sir, I also had a vascular transplant as I had a thrombosis in one leg. The arteries, does this affect my healing? Well, sure. Trauma, how your body responds to the pain. It tenses up to protect itself. It all goes to the fundamental fact that this is stress. This is a charge that's stuck in your nervous system. And we begin to create comfort and allow the body to relax and release that charge, and it gets that moving through your knee, your leg, your hips, your lower back. Everything comes back online. You sleep better, you think easier, you relax easier, you move easier. All of that happens as a result of creating comfort. Think about it. And it doesn't matter what your diagnosis is. I don't care if you've had surgery or not had surgery. Bone on bone to a knee sprain, it doesn't matter. Comfort guides the body out of pain. Unfortunately, the only options you have at this point is looking at where pain is. And if what we focus on expands, and it does, whatever you focus on, you create more of in your life. So if you're focusing on pain and pushing through the pain and doing things that are causing pain, well, guess what? You're creating and manifesting more pain in your body. And all we're doing is taking our attention off of that and now starting to create comfort. A little bit at first, and then we expand it. And what happens is we align ourselves with the technology, with the infinite capacity of your body to heal. What's going on? We line ourselves up with that ability of our nervous system to heal itself. When we focus on comfort, focusing on pain, it's not going to get you there. Especially if you've been in pain, starting out in pain. If you start out in pain, pushing through pain is not going to get you out of pain. That's what we're talking about here. Can knee replacement heal the pain? It cuts off the bones in your leg and replaces it with plastic and metal. If that's what you want to do, go for it. But think about it. You're getting the bones in your legs sawed off and replaced with plastic and metal. Okay, let's see. Sir, I'm having no pain, but still can't be stable. Yeah, it's an expression of your nervous system. Everything that I'm talking about is an expression of the nervous system. That's one of those things we could kind of go around in a loop. Just go do the 7-day challenge. Hi, Bill. I suddenly got pain in my left knee. Always okay before. Remember, I had replacement in right hip, left with lame left big toe. Now both left ankle and left knee sore. This is 5 years after hip. Hey, Leslie. Yeah, I mean, it had the experience our body has to offer us. It would overwhelm us and die, which is why the body goes into shock when we get into a car accident or something very traumatic. It needs to integrate all of that change that it's experienced in a very short period of time. So what ends up happening we have these like micro traumas that happen every day, stubbing our toe, headaches, all these different things. And what ends up happening is it ups the ante for our ability to tolerate the pain. So odds are, Leslie, you've been going for months, years of dealing with the pain, pushing through the pain, sucking it up, dealing with what's going on, and it ups the ante every time. And then all of a sudden, we do something very benign like reach over and pick up a Kleenex and something tweaks, and now we have pain. And we're like, oh, I didn't do anything. Nothing happened. Well, what we didn't do was pay attention to the weeks, months, and years of stuff that has built up in our body that got us to bending over to pick up the Kleenex, and then something pinched or tweaked. It's because everything got so tight. And that's why creating comfort is so valuable and so important, because it relaxes and creates more space. Relaxes the tension, it creates more space. And the more you do that, the more you train your body to understand what comfort is, the more space that you create in your body, in your being, in your nervous system, that what ends up happening is you have more space to move. Okay. Will glucosamine help with knee pain by renewing the cartilage? Yes, possibly. I don't know what the studies are. However, you have to change the pattern. That's like saying I got a car that got into a car accident, and if I change the tires, will the car straighten itself out? Probably not. We have to address the wear pattern that's going on in the joint. So then there's the space in the joint for taking supplements like glucosamine, MSM, chondroitin has an opportunity to work. That doesn't matter what goes into your knee or into your body, be it stem cell injections or any sort of injections in the knee if they're trying to regrow cartilage or meniscus in the knee. If you don't address the tension pattern that is causing the knee to wear to begin with, then you're kind of throwing good money after bad. Okay. I have pain on the inner side of the left knee. Kyra says it's not meniscus. MCL? I don't know. Think about the question you're asking me. That's like me going to a mechanic and saying, hey, I got this noise. It's underneath my hood. You think it's the carburetor? We have to empower ourselves with the knowledge and understanding of how, like, pain is nerve irritation. It doesn't matter if it's muscle or tendon or ligament or bone or fluid or fascia. It doesn't matter. Create comfort, get the pressure off of the nerves, and then the body heals itself. Go take the 7-day knee pain reduction challenge. I'll put the link in again. And then see what happens. You feel relief in your knee after doing it, great. I got more to help you. Well, we got to start somewhere. You got to feel something. It's like the sample platter. See if you like the chips before you buy the whole bag. That's the 7-day knee pain reduction challenge. I'm talking about something completely different that the doctors and the physical therapists aren't talking about. I get it. I'm not asking you to do anything unless you try it and see how comfort can make a difference for your knee right now at the speed of 286 miles per hour, at the speed of your reflexes. Go try it out. And if it doesn't work, no harm, no foul. Okay, great. I'll still train you to pay attention to what you may not have noticed, because it's all about awareness. Okay. The last question, my range of motion is up to 90 degrees. MRI and x-ray shows no sign of scar tissue. Doctor says it will increase by time. Will exercise help me in grade 2 ACL sprain? Grade 2 ACL sprain or ACL tear? What do you got here? Let me look back. Grade 2 ACL. If something is sprained, that means it hurts. There's a tendency for it to hurt. You exercise something that hurts. What do you think is going to happen? It's probably going to hurt more. You want to get it comfortable. When you get it comfortable, now the body has an opportunity to heal. Anything that you do in life moves forward better when you come from a centered, comfortable place. Doesn't matter what it is. Pushing your body through pain when it's already in pain is not going to get it out of pain. Okay, sprain. Same thing. That's why the instability is in the knee. Okay. Good questions. Good questions. Like the video. Give it a thumbs up. Subscribe to my channel. Turn on the notifications so you're aware of the next videos that I go live. I'll be doing these frequently. Share this with your friends. Those that are, especially the ones that limp, those will be the ones that you want to share this with. That's the best way to do it. And go take the 7-day knee pain reduction challenge on my website. That's a big thing. Like, getting out of knee pain is actually pretty simple and straightforward. Now, I'm not saying it's easy. I'm saying it's simple. And the reason why it's not easy is because we have to change our beliefs about pushing through the pain and how to address the pain. Once we start going to comfort, the body moves forward very easily, very quickly. We just have to stop doing the things that are creating the pain to begin with. It's like, anything else in life. This all lines up with universal principles of how the body heals. Okay, give another 30 seconds for any more questions. Okay, thank you very much. It helps a lot. Definitely follow your advice. Lots of good wishes from India. Thank you. Thank you very much. Let's see. We did the live Q&A. Got my notes. I want to make sure I get everything covered. But understand that you're not stuck. You are not stuck where you're at in knee pain. You can begin to create comfort today within moments. Head over to the website, take the 7-day knee pain reduction challenge. If you feel a change, we got some momentum going forward and we can get you some help. Okay, I'm going to scoot now. Thank you so much for being here. I appreciate all of you being on the call, asking great questions. And if there's any other topics that you want, if you're watching the replay of this, enter other topics you would like me to cover, and I will do so. Okay, Leslie has here. Bill, it's mostly been fine after hip surgery, but big toe issue affects balance. Calf muscles now weaker. Now suddenly knee pain in before a good knee. Leslie, my question is, the calf muscles weaker or something else pull tighter? That's consequently what happens with pain. Something doesn't get weak, something else pulls tighter. And we pay attention, we don't pay attention to what gets tighter. we pay attention to what we are told is weak. Okay, so since jogging on crappy jogging shoes causes pain, is cycling okay? Try it. Let me know. Thank you. Thank you, Sing. Okay, I'm going to scoot. Like the video. Give it a thumbs up. Subscribe to my channel. Turn on notifications so you're notified of new videos that are coming out. Go take my 7-day knee pain reduction challenge, and I will see you on the next video. Thank you so much. Have a great day. Bye-bye.